healthy people. Good to have you here again. Today we want to talk about urinary tract infections, UTIs. If you're new to this station, please quickly subscribe to it and click the like button. Make sure to click the bell button so that you may be notified each time I drop a video that will improve your healthy life. Having said that, what is urinary tract infection? A urinary tract infection, UTI, is an infection that affects part of the urinary tract. When it affects the lower part of the urinary tract, it is known as bladder infection. Some call it cystitis. And when it affects the upper urinary tract, it is known as the kidney infection. What are the symptoms? Symptoms from the lower urinary tract infection include pain with urination, frequent urination, and feeling the need to urinate despite having empty bladder. Symptoms of a kidney infection include fever and flank pain, usually in addition to the symptoms of the lower tract infections. Urinary tract infection, UTI, affects every portion of the urinary system, including the kidney, ureters, bladder, urethra. The bladder and the urethra are the most affected parts of the urinary tract infection. If you are a woman, you are more likely to develop a urinary tract infection. According to some researchers, the average chances of contracting one is as high as 1 in 2, with many women experiencing many infections over the course of the years. A urinary tract infection affects about 1 out of every 10 men in some point in their life. Here is how to deal with urinary tract infections and prevent them from happening in the first place. So let's talk more on that. How do you know when you have urinary tract infections? Well, let's talk about the symptoms. The symptoms of urinary tract infection include a burning feeling when you pee, a frequent or intense urge to pee is another one, even though a little comes out of it when you do. The third symptom is cloudy, dark, bloody, or strange smelling pee. You may also have a feeling of tired or shaky. Another symptom is fever and chills, a sign that the infection may have reached the kidneys. When you have this sign, you know that if you have a fever, you know that it might have reached the kidneys. Lastly, you also have pains or pressure in your back or the lower abdomen. When you have these symptoms, you know that you have UTIs, so you go for a test. Now, let us talk about types of UTIs. Infection may occur in various parts of the urinary tract depending on where it is found. Each form has a different name. The one they call cystitis, that is for bladder. You can feel as though you need to pee. Often you're having this feeling, or that peeing hurts you. Lower belly pain is another sign, and blurry or bloody urine are also possible symptoms. You may also have fever, chills, nausea, vomiting, and pain in the upper back or sides are symptoms of these diseases, especially that affects kidney or kidney inflammation. Another place you may also feel is urethra. When you pee, you can notice a discharge and a burning sensation. Then at that point you should know that it has affected your urethra. Let's talk about what causes these urinary tract infections. Doctor advised women to wipe from the front to the back after using the bathroom, or so as to prevent urinary tract infection. So don't wipe from the back to the front, no, wipe from the front to the back. You should also note that the anus is close to the urethra, which transport urine from the bladder into the outside of the body. So when we talk about one of these bacteria, that is E. coli bacteria, from the large intestine, can get out of it, that is through the anus, into the urethra on some occasions. They will then move up to the lungs, where they will infect your kidneys if the infection isn't treated. So once you have that sensations or feelings, you need to go for a test and make sure it's treated as far as possible so as not to get to your kidneys. Women's urethra are shorter than that of men, thereby making the bacteria to get into the urethra from the bladder so quickly compared to that of men folks, which is longer, thereby making women to get more of the infections than the men counterparts. Another important factor is sex activity, and this will inject bacteria into the urinary tract. Because of their genes, certain women are more prone to urinary tract infections. Others are more likely to get this infection because of the form of their urinary tracts also. So women with diabetes may be at even an increased risk because their immune systems are compromised, making them less likely to resist infections. Another factor is hormone fluctuations, multiple sclerosis, and sometimes that causes urinary production, such as kidney stones, a stroke, or a spinal cord injury, will all increase this risk. Having said that, let us briefly talk about urinary tract infection tests and diagnosis. You need to go to the hospital if you think you have a urinary tract infection. You have a urinary sample collected from you and be tested for bacteria that may cause UTIs. If you have a recurrent UTIs, your doctor may suggest what you need to do so as to prevent it all. And in that case, it may likely recommend ultrasound or CT scan or MRI scan. This can be used to investigate this thing more to see whether you have them or not. They can also examine the urethra and the bladder using what they call cystoscope, which is a very long and flexible tube that may be inserted or be used to see whether you have these infections. How do we treat urinary tract infections? Most of the time, and most often than not, it is antibiotics that are used most effectively as medicine for urinary tract infections. So if your doctor feels you need them, he will certainly recommend them for you. Do remember to take all the prescriptions of these medications. Some people will just take it when the situation improves, they leave it. That will not help you. Even if you feel better, continue to take it until you finish all the prescription. This will help. And another thing you can do, that will help to wash the body is to drink a lot of water. When you drink plenty water, it will help to wash and flush out these infections that the might have been weakened as a result of your using of this antibacterial. So you drink a lot of water to flush them out of your system. Your doctor can also prescribe pain relief for you to relieve some pains you may have in the body. So this can be beneficial, and you want to take them seriously and take all the prescriptions. Most time, cranberry juice is often sold as a way to avoid or to cure urinary tract infections. The tannin in the red berry can prevent this bacteria called E. coli. The most common cause of urinary tract infections, which is E. coli, can be prevented or you can fight it. This will help to make it not to adhere to your bladder walls, where they can cause infections for your body. So, however, study has found that it will not significantly decrease the infection rate, even though it is used. So, experts are now looking for ways to cure these UTIs permanently, or to even develop a vaccine or immune boosting supplement to fight it. You also need to understand something about chronic urinary tract infections. If a guy gets a urinary tract infection, he will most certainly get another. Yes, even if it seems that one is gone, most certainly will get another one. A second urinary tract infections affect about 1 out of every 5 women also, and some women get them several times. So each infection is usually caused by a particular form of strand of bacteria. However, certain bacteria will enter and propagate within your body cells, resulting in an antibiotic resistance, building a colony in your cells that resist antibacterial. After that, these bacteria will now open up the cells and move out of the cells to the urinary tract to infect your system. What about the treatment? Well, you need to ask your doctor for a recovery plan. If you have 3 or more urinary tract infections per year, ask your doctor for a recovery plan. Among the possibilities that the doctor may recommend is a low dose antibiotic given over a long period of time to help you reduce the recurrence of infection. And also, after sex, a single dose antibiotic, which is common infection cause, may be given to you. Moreover, antibiotics for 1 to 2 days, if sign occurs, may be given to you also. On your part, you can also use at-home urinary tests, which are available without a prescription, to determine whether you ought to see a doctor. If you are taking antibiotics for urinary tract infection, you should check and see if they have worked, so that you know, although you still need to finish your prescription. So whether it has worked or not does not stop you from finishing your prescriptions. How do we now prevent this urinary tract infection? One is to stop having another urinary tract infection. Follow these guidelines. Frequently empty your bladder as soon as you feel you need to pee. Yes, once you feel you need to pee, just go and pee. Don't hurry, and make sure that you have fully drained your bladder before you leave. Once you have used the restroom, wipe your hands. Yes, wipe your hands and if you're a woman, wipe your urinary tract outlets from the front to the back. ensure that you consume plenty of water and other liquids. Shower are preferable to pools. Yes, it's better you use shower when you want to take a bath than enter pools. Avoid what it's called feminine grooming sprays, scent debut, and scent baths because they can irritate the skin. Moreover, after sex, clean your genital regions to wash out any bacteria that might have infiltrated your urinary tract. Pee. Always remember to pee after sex. And if you are currently using a diaphragm, make sure that, or sometimes you're using a condom or other spermicidal jelly for birth control, you should consider switching to a different form. Unlubricated condoms and spermicides can irritate your urinary tract, while the diaphragms can also promote bacterial development. So both of these factors will increase the likeliness of urinary tract infection symptoms in you. Another point is for you to wear a cotton panties and loosen fitting clothing to keep the genital region dry. Wearing tight jeans and nylon underwear will trap moisture and provide an ideal atmosphere for bacteria to thrive. If you put this into practice, you'll discover that you have a healthy life. You'll be able to cure and avoid having urinary tract infections. So thank you for watching. That's my video for today. Thank you for staying till the end of this video. For more easier way to have a healthy lifestyle and prevent infections in a very natural way, check the description of this video and you'll be happy you do. Please subscribe to this channel for more. Thanks and God bless.